So, hello to all the viewers. The INISS May DM Neurology entrance results have been announced, and with me, I've got Dr. Pratiksha Sahu, who has secured rank 1 in the AIMS merit list and rank 4 in the common merit list. And while getting a single digit rank and that too rank 1 in such a prestigious competitive exam is no mean feat. It is an outstanding achievement. So first of all, hearty congratulations to Pratiksha.
Thank you, sir.
So Pratiksha, I think the viewers would also want to know what was that feeling, when you got that rank 1.
Sir, I really did not expect, I did not anticipate that I'll be getting rank one. I was really hopeless. I don't know, like after NEET, I did not have much expectations. Although the paper was much predictable as per what has been taught, the paper was much predictable and easier, I would say, as compared to NEET. So I had little bit of expectations that I might get NIMHANS per se, but I never had any expectations. Like I never thought that I'd get AIMS Delhi and that to rank one. I'll be eligible
Right,
for that. So
right,
I was too overwhelmed. Like my whole
right.
family,
Great.
it was another experience altogether.
That's great. And can you just tell us from which college did you do your MBBS and then subsequently your post graduation from?
Sir, I did my MBBS from People's Medical College. It's a private college in Bhopal. I'm basically from Bhopal. And then
Okay,
I did my PG from Bhopal itself, Gandhi Medical College, Bhopal.
okay,
So that's
right,
what
got
my
it.
story is.
Right, right. And coming to your preparation journey with DocTutorials. Now, INI we know is pretty much competitive, and you will have to prepare very well to get, especially such an awesome rank. And for the viewers who are listening to Dr. Pratiksha, we also would definitely have the current medicine residents as well in the audience section. So if anyone is wondering what this AML and CML is, it's not any acute myeloid leukemia or chronic myeloid leukemia. It is just a AIMS merit list rank and the common merit list rank. Because even yesterday, Pratiksha, as I shared the posters of the students, many people were messaging me, what is AML? Is it a specific exam on acute myeloid leukemia? So I said, no, it is AIMS merit list. So to get this awesome rank is great. And so coming to the your journey with DocTutorials. So first of all, tell me about the videos in DocTutorials, like neurology videos. We had the main video section, the QRP videos, Harrison's tables and flowchart videos. So how did the videos help you in your preparation, the neurology videos in DocTutorials?
Sir, they were the best, like for revision purposes, for compiling everything. It was a great thing, like the videos you've provided. Specifically the elite discussion videos. I watched almost all of them, honestly. So the elite discussion videos were of great help. The question bank, it had so many different questions. They were so diverse questions and so much. Like if you revise, like they were really good to go to revise the subject. And then we had those QRP videos and TND videos. I watched all of them, and the most helpful to me was the mock interview videos. Although I've watched all of these videos, I have been preparing for NEET as well, so I watched them earlier. So I can't exactly tell you which questions were from which video. But then recently I watched the mock interview videos. So mock interview videos, I think they were the most they were most helpful because the way you had taught us to describe the scans, the neuroimaging part, and I got one question from it, so I could describe it very well. So I think that satisfied the examiner, and I was able to impress them somehow because I described it very well because they had taught it repeatedly in the mock interview videos. And
Right.
then the other elite discussions also, you have covered everything, sir. So it was a great platform to concise everything and revise it again and again. And even the Harrison tables, I watched all of them. So everything was helpful, sir. Equally
Right.
helpful and contributory to getting the rank.
So you talked about the Elite test and discussion videos. Now, for the viewers,
Yes.
every year we conduct the Elite test and discussion, wherein we conduct exams, and that is actually a system-wise MCQ exams with definite topics for each exam. So the student prepares according to the topics assigned to each elite exam, and maybe neurology will be divided into four separate sections, and then we'll conduct discussion videos as well. So Pratiksha, coming to these elite test and discussion videos, now I'm sure that during your preparation you will watch video lectures, you will make notes, but again, when it comes to MCQ discussion, so did a faculty's approach in solving MCQs, like when you watch these elite test and discussion, you're watching me how to approach, like how I would have answered that question. So did such an approach, did watching multiple such video refine your MCQ solving approach, and again to highlight certain important topics that maybe you would have missed during your first reading, like in your routine lectures?
So definitely, sir, they were of great help. Uh, Mainly the MCQ discussion videos, as you've quoted, because it helps you revise all the topics. Watching the like videos in the first place or reading through the notes, they don't help refine the knowledge as such. I believe so, because if you want to revise, these videos are the best way to revise the topics, and also it helps you focus on the important topics, because you repeatedly are discussed about few topics which were discussed again and again in the videos, different elite discussion test series, series. So I could understand these topics I need to focus on. And then
Right,
and even the WhatsApp group, sir, I would
right,
really like to appreciate the discussions on the WhatsApp group and one-on-one doubt solving, because we could ask doubt and you would answer very quickly, and also you would daily conduct discussions, MCQ discussions. So they were of great help, because that would help us revise all the questions, sir, all the genetics and all. It's very volatile. But since you
right.
repeatedly asked them and you repeatedly discussed them in the video, so it helped me remember all of that volatile matter.
Got it. So we're talking about revision. I think that is again very important because that is an important message to the future aspirants as well. Because what happens is when you prepare for such an exam where the portions are very vast, it's okay that yes, during preparation you're doing it fine, but the last few weeks before the exam, you will have to concise your content so that you can finish your revision. And that is why in the DocTutorials app that we have the QRP videos, the quick revision video that Dr. Pratiksha was talking about. So these are very concise, crisp videos, and you can definitely cover a lot of topics, in these revision videos. So I hope, Pratiksha, you have gone through almost all of these short capsule revision videos.
Sir, I've gone through QRP videos, elite discussion videos, TND videos, sorry if I'm mixing them up, and Harrison table and videos.
Got it.
Then also the MCQ question bank of I&I, and as well as the MD General Medicine question bank for
Got it.
neurology. So
Right.
it was all again and again revising the important topics. So it helped a lot.
Got it. So coming to this Q bank, that is question bank practice. So how were the questions in the doc tutorials Q bank? I've got to ask you two questions. Number one, were you satisfied with the type of questions that were there in the Q bank? And number two, did you like the segregation of questions into the general medicine part and the INI part so that you can prepare accordingly? So can you just tell about that?
Definitely, sir. So the question bank, like INI question bank for which I did just recently. So
Right.
initially, when I did it for the first time before I started my preparation for the INI per se, so I could not attempt many MCQs, and they were like literally detailed, and they
Okay.
helped you revise the concept, because it's a very good way to revise the topic you've just read. So they were very detailed, and they could cover almost everything. There were like 60 MCQs in every module. So every
Right.
topic had 60 MCQs. So I did them first in the first go. Then I revised the whole thing. I saw all your videos. You gave us targets in the WhatsApp group. Yeah, today you have to watch LE discussion. Today you have to watch QRP. So I was following that. And then after that, I did that again. So I could see the difference, and I could do better in the MCQs. I did the whole question bank again. So the time was there. So I think it was feasible. I could do it. And definitely the question banks were discreetly segregated, and it helped you revise all the topics in detail, because reading through the notes is one thing, but revising them through different videos and then MCQs and then different types of videos, sir, it really helps to build the concepts and the
Right.
memory as well.
Right. So some time back, I just took the interview of Common Merit List Rank 1, that is Dr. Madhu. So Dr. Madhu also was telling that she went through the entire question bank of DocTutorials. I was surprised that she said there is not a single question that she has solved in the entire Q bank. And she said she revised the Q bank also once. And she said for the grand test as well, she has written the 56 grant tests that were there, including the previous ones, and she had reviewed the grant test as well. So, what was your, stats with the MCQs? Were you able to do most of the questions in the Q bank? And what about grant test as well?
Sir, I did the same thing actually what Dr. Madhu did. So I
Yeah,
did the question bank of the general medicine part because I was like after my SRship got over, I had
right,
time in my hands. So it was
right,
like a 3 to 4 months time. So I had the time and I did all the question banks of the general medicine and I
okay,
revised them as well after a period of time. Like you have that feature as well where you can see how on what date you attempted the module and then how much you have improved. So that helped me understand ki these are like my weak parts. I was mainly
right,
focusing on my weak topics first of all. Secondly, in INI part also, I revised them twice as I've already told you. So sir, that was like uh, I had the time. I don't know, some people complain that they don't have enough time to go through all the question bank, but I had the time in my hands and they were of great help, definitely. So, yes, sir, I did them twice as even like, and
right,
they were
got
very
it,
helpful, sir.
right. And again, after the round one, you've got a good you might have anticipated, yes, I've done decently well. So one question I want to ask you is, see, you have improved from rank 4 to rank 1. Many students have a notion that preparing for the stage 2, that is the interview round, might be similar to that of the stage 1, but that is not the case. So the viewers would want to know from you as well, do you think you can just revise those MCQs once again and go to round 2? Is that the way to prepare?
So you clearly mentioned in your videos that that is now how you have to go forth. You have to have a different approach for stage two. Also, you had shared many PYQs on the group. So I could
Right,
understand, even my friends, we were like whoever was studying with me, we had a discussion group and all. So we all realized that these are very different questions and they have a very different approach. And
right,
you covered most of it in the mock interviews.
right,
So I just mentioned earlier, like the mock interviews, the way you described everything, like I never learned how to describe a CT in such detail or an MRI in such detail, and you got like you helped us practice it in almost all the videos, and definitely
right,
that helped me. And
right,
also the way to approach the interview, because I think the discipline that you need to have and the conduct matters while you are giving the interview. Because
right,
like I feel I did not waste much of their time, and you had prepared us that way. Ki you have to
got it,
give the interview in such a way. So I
right,
had all of that in mind. So I think they were
right,
happy with that because I literally out of three questions I could not answer one. Like I had a lot of doubt in that. But despite that,
okay,
they were like, if you have a doubt, we'll proceed ahead. So I told them I'm not very sure about this. We can proceed ahead. So I think they were happy with that because I didn't waste their time. And you had
got it.
taught us how to approach that. So I think that helped a lot, the approach and the conduct and the whole thing.
That's again very important, because even after the results were announced, I think I've got a few students who have messaged me like they had good improvement after the interview. Even yesterday, I had a candidate, I think Dr. Gauri. She got a common merit list rank of 75, but her AIMS merit list rank is 28, and her interview mark is 19, 19. So that is what an interview round preparation can make a difference. So Dr. Gauri was messaging me yesterday that she had that much of an improvement, because CML 75 means you have no chance. But
No
this
chance.
sort of improvement after the interview round, and even I think one more candidate, I think scored 14. I think Veena, I think that was the candidate's name. She also had a very good improvement after the interview round. So that's what I want to tell the viewers as well. Exactly what Dr. Pratiksha is telling. you have to take the interview round also seriously, and don't think that it is just yes, you will just have a few minutes to answer, but again, you have to prepare solidly for that, so that if a question is put in front of you, you're able to answer spontaneously and fluently. So I think, very wise messages from Dr. Pratiksha to the future aspirants. And thank you so much, Pratiksha, for joining us. And I'm sure that, the achievement that you have made is going to be an inspiration for many more aspirants from your college, your state, and even across the country as well. Thank you so much for joining, and all the best.
So thank you so much for having me here, and also thank you for everything that you have done for us for all, like during all these months. And without you, without like it wouldn't have been possible, definitely. And thank you so much, sir, because I don't think I would have ever secured this rank without all your efforts and contributions in my preparation. Honestly, sir. So,
But
sir,
actually,
Dr. was really helpful, sir.
thank you so much for your kind words. But definitely, the effort that you have put in over the last several months, that is actually, shown results now. So thank you so much, Dr. Pratiksha.
Thank you so much, sir. Thank you so much for having me.